Trauma is a common and pervasive problem that people experience. It happens at any stage in development, but essentially what trauma is a problem with memory. Something has happened to the person, either one-off or over a period of days, weeks, months, or even years, that at the time it's occurring they haven't been able to cope with fully. And so it gets stored away in memory as a series of sensations and emotions that then later in life penetrate into the present. So inexplicable emotional responses or very strong emotional responses, memories that recur for no apparent reason, problems with sleep. These are all symptoms of traumatic experience. Trauma gets diagnosed usually at the clinical level as post-traumatic stress disorder, and therapists have measures. We can do it just by interviewing and looking at what your symptoms are, but there are also questionnaires that we can use which can determine whether you actually indeed have the problem or not. Very curable. We wouldn't have said that necessarily 20 or 30 years ago, but with advances in brain science and our understanding of how human memory works, trauma can be treated quite successfully in most cases. Trauma is caused by any extreme experience that someone suffers. So trauma can come as a result of a car accident, trauma can come as a result of a robbery, trauma can come as a result of sustained childhood abuse, trauma can come through a mugging, trauma can come through ongoing conflict with a loved one, such as in an abusive relationship. Trauma can come from military service. We've worked with a lot of returned servicemen, both Australian and from other parts of the world. Trauma can come from migration. So people that have gone through refugee camps or have come out on boats and things like that, all of these can lead to traumatic experience. Anxiety is something that occurs normally in the body to some extent in all people. So if we didn't have some capacity for arousal, then we'd just really be laying on the ground like a jellyfish. So in order to get up and to respond to things that happen to us, we need a degree of arousal. When that arousal is excessive or that arousal doesn't turn off, then we'd say we'll have anxiety. There are many different types of anxiety. Post-traumatic stress disorder is a type of anxiety problem. People have phobias, which is an anxiety problem, and phobias can be of snakes, they can be of flying, they can be of other people. We call that social anxiety. People can get anxious about symptoms in their body, which we call generalised anxiety. So they think that they're getting really sick because they have stomach complaints. That's a form of anxiety. There are many forms of anxiety. Stress is similar to anxiety. Stress is your body's nervous system responding to external or sometimes internal experiences. So people talk about work stress, people talk about relationship stress. Stress can come from the way we think about things, which is, humans are very different to other animals. We can create stress just through thinking about something rather than having it happen to us. But it's just a normal biological response. It's really trying to trigger our body to go into a flight, fight or freeze response. Early intervention is always important with conditions like stress or anxiety, because often just a couple of sessions with a good treating practitioner can give you the skills to be able to stop the build-up of stress or anxiety rather than wait for it to become a major problem down the track. So always best to check in with this sort of problem earlier than later.